Good morning, UN delegates. This is Webster Schrader, Model UN News. I'm Mrs. Tyne. Today we will be looking into the ongoing crisis in Yemen. For 3 years now, the Arab world's poorest country has been racked by a bloody war between the Houthi rebels and supporters of Yemen's internationally recognized government. When the Houthis captured Yemen's capital Sana'a in September of 2014, a coalition of Arab states led by Saudi Arabia launched a military campaign in 2015 to defeat the Houthis and restore Yemen's government. While denying any active involvement, it is widely acknowledged that Iran is supplying the rebels with drones, missiles, and IEDs, or improvised explosive devices. The official death toll stands around 10,000 people killed in the conflict. However, an independent study has argued the number stands much higher at 56,000, including civilians and combatants. In addition, famine is sweeping the country with an estimate of 50,000 children dying in 2017 alone. We will begin our in-depth coverage on what the UN committees will be doing for this crisis. First, we look at the Human Rights Council. Now over to Mr. Eckler.
Thank you, Ms. Tyne. Since the fighting began here in Yemen in 2015, UN human rights experts believe that war crimes may have been committed by all parties. Just last August, the United Nations Human Rights Council released a report alleging Yemeni government forces and the Saudi coalition backing them, along with the rebel Houthi movement, have both made little effort to minimize civilian casualties. They both could be held accountable for human rights violations. Some of those violations include attacks on residential areas, torture, detaining citizens without cause, and the recruitment of child soldiers. According to the UN report, coalition airstrikes led by the Yemeni government and backed by Saudi Arabia have caused most civilian casualties as they have mistakenly hit funerals, markets, medical buildings, and other public spaces. The report also expressed concern at the situation in the southern city of Taiz, where the Houthis have been attacking the government-held area for 3 years. The report says civilians, including women and children, have been hit by shelling and snipers from the Houthis and other parties while in their homes fetching water at local wells or on the way to purchase food or seek medical attention. The UN Human Rights Committee must now draft a resolution to this crisis after examining the facts. Several experts say they could be identified for blame from individuals who may be held responsible for war crimes, and they could also urge the international community to refrain from providing arms that could be used in conflict. It is believed that Saudi Arabia is backing the coalition while Iran is smuggling weapons to the Houthis. Despite the severity of the situation, we continue to witness the total disregard for the suffering of people of Yemen. I'm Mr. Eckler, reporting live from Yemen with UN News.
Second, we look at Disarmament Committee. Now over to Mr. Peck.
The violence in Yemen, which began 3 years ago, has negatively impacted the citizens of Yemen. The ongoing violence has resulted in extreme difficulties and challenges in Yemen, such as much-needed resources reaching areas affected by violence. According to senior researchers at the Human Rights Watch, one specific action that is contributing to the ongoing situation is the use of cluster munition attacks in Yemen. A cluster munition is a form of air-dropped or ground-launched explosive weapon that releases or ejects smaller submunitions. These attacks have been used throughout Yemen, specifically in or near heavily populated areas. The danger of these weapons is that children in Yemen can or have picked up the remnants of these munitions days or months after they have been used. This has led to many injuries and even death for children in Yemen. In 2008, 120 nations signed the Convention on Cluster Munitions, which prohibits the use, production, transfer, and stockpiling of cluster munitions. It also requires destruction of stockpiles, clearance of areas contaminated by remnants, and victim assistance. However, the United Nations has had difficulty implementing and enforcing the convention, which has led to these appalling weapons still being used to injure and maim civilians in Yemen. Currently, the UN Special Envoy to Yemen, Martin Griffiths, has been working on talks between Yemen's warring parties focused on disarmament. The conflict has already claimed 10,000 lives in Yemen. A signed agreement between all parties will include putting in place security arrangements for withdrawal of all armed groups in Yemen and disarming them. Despite the efforts of those involved, battles and attacks continue to take place across the impoverished country. The cost of this conflict has been extraordinary and has included the untold loss of innocent civilian lives. The UN Disarmament Committee must now draft a resolution in line with their global norms for disarmament and help end this violent crisis in Yemen. And now back to the studio.
Third, we look at the World Health Organization. Now over to Mrs. O'Brien.
The situation in Yemen has produced an unrelenting humanitarian crisis, with at least 8.4 million people at risk of starvation and 22.2 million people, 75% of the population, in need of humanitarian assistance. Severe acute malnutrition is threatening the lives of almost 400,000 children under the age of 5. Yemen's health system has all but collapsed, while the world's largest cholera outbreak has killed thousands. Less than 50% of health facilities are functioning versus 90% in 2013. 18% of districts in Yemen have no doctors. 56% of the population, 16 million people, do not have regular access to basic health care. We're here today with Mr. Alquist, spokesperson for the charity group Doctors Without Borders. How is the situation in Yemen continuing to impact the health system?
After years of war, thousands of people are dying from easily treatable diseases. Meanwhile, the entire health system is collapsing around them. Drugs are disappearing from the market or skyrocketing in prices. Mental health care is virtually non-existent. Vital hospital equipment is stuck at ports, and medical convoys, ambulances, and entire hospitals have been destroyed in the fighting.
From August through October this year, Doctors Without Borders has been the target of bombings and airstrikes. How has this impacted the work your group does?
Due to the severity of these attacks and the clear lack of safety for our teams working here, Doctors Without Borders has been forced to withdraw our staff from many areas of Yemen. We've suspended medical programs in these areas until further notice, leaving thousands of Yemenis without humanitarian and medical assistance.
For the people of Yemen, it is another blow to an already disintegrating system. Reports continue to be received about limited health services due to a lack of staff, and now there are also concerns about interrupted electricity service due to the fighting, which constitutes a major challenge to hospitals. What other challenges are faced by those trying to provide medical services to the area?
The conflict is impacting our ability to respond to the needs of hospitals and health facilities. It's also affecting the delivery of medical supplies, including medical kits for patients requiring surgical or trauma care.
Many have said that the rainy season from May to August this year has complicated the situation. How?
The rainy season has resulted in limited access to safe drinking water and damaged sewage systems. And this has resulted in the spread of cholera and concerns of cholera spreading even further. Since Yemen's cholera epidemic erupted in April 2017, a total of 1.2 million suspected cases have been reported, including 2,515 deaths.
Yemen's cholera outbreak is now being called the worst in the world and is unfortunately accelerating again. Thank you so much for speaking with us, Mr. Alquist.
Yes, thank you very much.
The situation in Yemen continues to create a domino effect. It is not just the physical safety of citizens, but their health and mental well-being that is being impacted as well. And now back to Mrs. Tyne.
Fourth, we look at the Economic and Social Council. Now over to Mr. Fabry.
Hello, I am on location in Yemen's financial district. After more than 3 years of escalating conflict, Yemen continues to face an unprecedented economic crisis. It is the Middle East's poorest economy and continues to struggle despite economic aid packages. The International Monetary Fund has noted urgent needs for food supply and public sector salary assistance. The UN is attempting to raise $3 billion in funds for their economy, but has yet to reach that goal. In reality, Yemen may need much more than this target. The escalation of violence in Yemen has halted exports and negatively affected the issue, with most businesses having to make substantial layoffs. Yemen will require significant international assistance during and after the conflict to stabilize its economy. Long-term challenges include high unemployment, declining water resources, and severe food scarcity. With a GDP per capita of just $2,500 per year, Yemeni people are struggling to survive. Without substantial contributions and an end to the conflict, the economic situation here in Yemen will unfortunately continue to deteriorate. Thank you, and now back to the studio.
Fifth, we look at the UN Women. Now over to Mr. Stoll.
Hello, I'm Luke Stoll, reporter for the BBC, and I'm here in Yemen joined by two of our experts who have seen firsthand the effects of this crisis on women and who are here to give us the details of the effects on Yemeni women and girls. Here with Emma Smith and Samantha Dimitrescu, with the ongoing war occurring in Yemen, women and girls must fight for survival during this trying time. What are some of the challenges they have faced when confronted with these violent conflicts?
The war in Yemen has taken a toll on its citizens and has especially placed a heavy burden on the women's shoulders. Yemeni women are stepping into roles traditionally filled by the men and who have been killed, injured severely, kidnapped, or have lost their jobs. Now, not only do they have to be the caregivers of their family, but also be the main provider. Although impoverishment and the lack of medical care are pervasive challenges in their society, what is even more disturbing is the 36% increase of gender-based violence and the 66% increase of child marriages. Challenges such as these plague women and girls' lives every day. Without proper support, their rights and privileges as human beings disappear and cannot be exercised freely.
Now, Yemen has historically struggled in guaranteeing the safety of women. Can the challenges faced by Yemeni women be directly attributed to the war?
In Yemen, it is difficult to make a precise distinction between gender-based violence cases related to the ongoing conflict and the ones unrelated to the conflict. Although violence against women was already a prominent issue in the area, the conflict has worsened the vulnerability of Yemeni women. The gender dynamic and inequality in Yemen, paired with the chaos of the crisis, has left women and girls extremely susceptible to abuse and exploitation.
The current crisis in Yemen has made it one of the United Nations' top priorities. With the presence of unnecessary violence and the continual infringement of human rights, we are looking to the UN Women Committee to take actions that can help to protect Yemeni women and girls. Back to you.
All right. Good morning, delegates. I'm Mrs. Silliman. Now you need to try to help the people in Yemen affected by this situation. Your committee will be addressing a specific component of this crisis and proposing an emergency resolution to the Security Council. Your chairpeople will share with you additional specific talking points that focus on the component of this crisis that your committee would address. Your emergency resolution should have at least 3 preambulatory clauses that focus on the specific part of the problem your committee is looking at, and at least 3 operative clauses that you ask the Security Council to take action. The mandate of the Security Council is as follows. When a complaint concerning a threat to peace is brought before it, the Security Council's first action is usually to recommend that the parties try to reach an agreement by peaceful means. The Council may set forth principles for such an agreement, undertake investigation and mediation, dispatch humanitarian missions, appoint special diplomats to the situation. When a dispute leads to hostilities, the Security Council's primary concern is to bring them to an end as soon as possible. In that case, the Council may issue ceasefire directives that can help prevent an escalation of the conflict, dispatch military observers or a peacekeeping force to help reduce tensions, separate opposing forces, and to formulate plans for the establishment of a system to regulate armaments, and establish a calm in which peaceful settlements may be sought. Beyond this, the Security Council may opt for enforcement measures including economic sanctions, arms embargoes, financial penalties and restrictions, and travel bans, severance of diplomatic relations, or a blockade. A chief concern is to focus actions on those responsible for the policies or practices condemned by the international community while minimizing the impact of the measures taken on other parts of the population and economy. Now, delegates, it is your turn to try to propose solutions to this current crisis in Yemen in order to help all affected. Good luck.